And we'll get into week 9. So welcome. Like I said, congratulations making it this far. Week 9, just like it was in series 1, series 2 is also going to be about mental health interventions. So before we go much further, I always like to clear up any kind of confusion because it can be a little bit confusing. We are saying you're doing mental health interventions, but yet you are acting as a TBS, as a case manager. You're not providing actual therapy. So I just always like to start with a little bit of a clarification to be careful to stay within your scope of practice. Please also, if your client has a therapist, please be sure to be in contact with them and to be reinforcing what the therapist is teaching would be your role if your client has a therapist. If your client doesn't have a therapist, you can still provide mental health interventions. In that case, though, you would just want to be checking in with your clinical supervisor if you're unsure about what to be doing as far as mental health interventions, or if you feel like you need more guidance, please don't hesitate to reach out to them. But you can, as a TBS, provide mental health interventions, just being sure that you're doing so from a case management standpoint and not so much a therapy standpoint. So just real quick example to kind of clarify that even more. Last series, in series 1, we learned about mental health interventions, and the one that we learned about specifically was the decisional balance matrix. That handout and that that activity by itself is not providing therapy. It's more of doing a pros and cons list, if you remember. But because it comes from a motivational interviewing background, it's based on motivational interviewing, it's considered to be a mental health intervention because it does have that theory behind it. So that's kind of where the gray area, I think, comes in, that you are providing mental health interventions such as a decisional balance matrix. Today, we'll learn about some others that you may not have heard of before, but you're doing so as far as skills, as far as doing that pros and cons list, as far as brainstorming, as far as identifying symptoms, making plans, advocating, you're coordinating, you're staying in that lane of case management and not actually going in to therapy. So any questions? I know there's always some confusion around that when we get started. Questions or comments around mental health interventions before we go any further? Okay. All right, very good. So Stacy should have emailed you all, I think, five or six handouts. And today's topic, as it relates to mental health interventions, is going to be some activities that have a root in ACT, or acceptance and commitment therapy. So if you haven't heard of acceptance and commitment therapy, we're going to give you a nice intro today. Today, you're not going to become certified as an acceptance and commitment therapist, but you will have the foundations on what you need to know in order to do some ACT activities with your client. So let's reference the handout. So if you'd like to follow along, you may. The next couple slides are going to be pretty much following handout 3.9.1, which is a good overview of acceptance and commitment therapy. So if you'd rather follow along on the handout and take notes, that's fine. Or if you prefer to follow along with the PowerPoint, it's going to be pretty much echoing what is on that particular handout. So let's go ahead and get right into it. You actually have already learned a couple activities that are based on acceptance and commitment therapy. If you remember back to the values skill building exercise that we learned about in week 3, those actually are coming from ACT, or acceptance commitment therapy. So you actually have already been introduced to some ACT activity. So other things that we talk about may sound familiar because you may already be doing some of these, or we may have actually already introduced you to some of these having a basis in ACT. So first, let's kind of talk about what it isn't. Sometimes it helps to talk about what something is not before we start talking about what it is. I want to let you know that ACT is not looking to help your client eliminate any difficult feelings. We're not trying to support them to avoid situations that are triggering. So I hope you don't come away with that perspective, because that's not what it is about. It's not about eliminating those feelings. We can't get rid of them. It's also not about avoiding difficult situations, because we also can't always avoid triggering situations. But what it is is being present, kind of being mindful, being in the moment, being accepting of what life brings is the first part of it. Another step of it is moving towards valued behavior, which is where those values activities came in that we learned about during week 3. That also, like I said, has a basis in ACT. And instead of avoiding situations that are triggering, or instead of eliminating difficult feelings, instead, we're teaching our clients skills to be open to uncomfortable feelings and kind of finding meaning in experiencing those uncomfortable feelings, because there's often a lesson to be learned. And sometimes the lesson is learning how to not overreact. So that's one of the big parts of ACT. It's just getting comfortable with what is going on, being in your difficult feelings, being in a situation that could be triggering, but figuring out how to cope your way through it, or how to use your skills to get through it. Because life is going to be triggering. I can't get rid of all of your triggers. I can't, build a bubble around you. But what we can do is learn skills to accept what's going on and to, like I said, cope our way through it. So that is the first A in acceptance and commitment therapy, is acceptance. Being willing to experience difficult thoughts. So you might even start there with your client. Do they have a willingness? Are they ready to start experiencing difficult situations and difficult thoughts? That may be the first place to start, but through accepting, or through learning how to accept difficult thoughts, feelings, situations, what we're helping clients to do is recognize that there are some things out of their control, and sort of let go of that struggle against it. Maybe stop trying to control things so much. And when they do that, they'll find that they then are left with what they can make a decision about, that they do have control over, which is themselves, their own thoughts, their own actions, is kind of what they're left with. So that's the first kind of pillar, the first kind of tenet, is just starting with acceptance that life is difficult. I can't always control things, but there are some things that I can control. And it boils down to being able to control myself. And I really think that TBS can intervene and support a client a lot through this acceptance, by maybe just helping them brainstorm, what are those things that they do have control over? What are those things that they don't? And just coming up with a list sometimes can be very helpful to help a client realize where they could put their energy, or where they could focus. Once they can accept what they can't change, they can then go forward and work on the other steps in ACT. But oftentimes clients get stuck until that acceptance takes place. I don't know, I didn't plan this, but we can stop and have a quick discussion. If you have ever seen any clients really stuck and not being able to accept what they cannot control, and how did that hinder them? How did that prevent you from to be able to help them to move forward when they cannot accept what they can't change? You can either unmute and share if you've experienced that, or you can go ahead and put it in the chat. Clients that are struggling with control, what that's been like for you, or what that's been like for them.
I had a client that she had like issues with her daughter, and they were very her daughter was very controlling and abusive. So I introduced a circle of control, and she was very resistant. She was like, "This is how I am." Like, when people want to control you, you worry constantly about their behavior, and you walk on eggs, and you constantly try to figure out like how to stay safe. So she was really focused on her daughter. And so when I introduced her, she said first to me, she said, "This is how I am my whole life, and it's not going to work." And so then I kind of let it alone. And so I just explained it to her, and then she understood what it was. Then
Okay.
she had so much anxiety, and then she had a breakdown, like an anxiety attack. And then she reached out to me and she said, I don't like to feel like this. I don't want to feel like this anymore. So then we continued with the circle of control. And then I said, if we can work together by focusing on the things that you can control, and that will help you to reduce your anxiety. So then we went like step by step, and that really like helped her. Like, but in the beginning, she did not believe, and now then she took it like wherever she goes, she took like the paper of the circle of control.
Mhm.
That every time when she had like anxiety, she would like read and try to figure out like, am I still in the circle of control? And now she is
Aw.
like all like so thankful that we did it. And then she admits, she said, when you started to talk about this, I really thought that this was not going to work. And now she recognizes that every time when she goes back to the things that she can control over, she just starts to feel better. So she's like,
Mhm.
she went from a non-believer to a believer in the
That's
circle of
great.
control.
That's awesome. Yeah, a couple things I want to point out from what you said, honey. First of all, I don't want to imply that this is easy. This is to give up control is not easy. So it sounds like it took your client a while to think through what you were telling her and to think through that circle of control and to come to a place of acceptance. So yeah, just because I have this little arrow pointing to acceptance doesn't mean that will take one session. It could take 5, it could take 6, it could take coming back to it when they're ready. So yeah, not easy and usually not something that you just do one time. You may have to follow up. Sounds like what you did, a couple of different conversations, giving a couple different examples until they're ready. And it's not easy to give up control, but that's a great example. Thank you for sharing that. There's a couple in the chat. Jessica has a client who has been struggling with schizophrenia diagnosis, refuses to accept it, has been in denial, acknowledges the anxiety and depressive symptoms, but that's it. Her acceptance has been a barrier in going forward. Okay. Yeah. So if she won't acknowledge other symptoms, how can you work on those symptoms until she's acknowledged it? That kind of makes sense. And then Kirsty also has one client that wants to control everything around them, but he doesn't have anything else because he's blind and paralyzed. He just lays in bed and will not be able to get out of bed. So wow, talk about a lot to work through, to accept. That's a lot to accept right there. What he does and does not have control over. So yeah, maybe Kirsty, maybe we'll come back to you because that's a different kind of client. That's a different kind of situation. I'll check in maybe with you here in a little bit and see if you have anything to share on the other topics as well. Okay, great. So that's a nice, just real quick introduction to acceptance, what that looks like, what it is, a nice definition about it. Kind of going around I guess, is that a hexagon? Next would be what's called cognitive diffusion. It's a big fancy word for really just having clients notice their process of thinking rather than getting caught up in their thoughts. ACT goal is to help your clients change the way they interact with or relate to their own thoughts. And this is very similar to challenging negative thought patterns or challenging inaccurate thoughts that people are having. So adding more helpful meaning to thoughts kind of gives them less power. So here, what we're looking at is their process of thinking, not necessarily what they are thinking. So we'll get a really good activity here later that may explain that a little bit better. But what it's boiled down to here in the graphic is cognitive diffusion is observing your thoughts without being ruled by them. So kind of accepting that I'm having these thoughts, observing them, kind of seeing them from the outside, and then trying really hard not to get caught up in them or to be ruled by them is how it's described there. Kind of a separation from me and my thoughts is what cognitive diffusion is. And like I said, we have a really great activity a little bit later to help your clients maybe visualize that or to work through how to do cognitive diffusion. So that's the next stop along the way. I'd be willing to bet that a lot of you are already doing this next one, being present, being mindful, being in the moment. I do read a lot of your guys' progress notes that talk about mindfulness, being present, being in the moment. So you guys are probably already doing this and not realizing that it's part of ACT. But what this is, being present, is becoming attuned to what is occurring right now in this moment around them, within them, noticing if their thoughts go to the future, go to the past, if they're stuck on a particular person, place, or situation. It's just kind of noticing again, focusing on the here and now and trying not to judge. So it's very similar to mindfulness, very similar to being present, just being in the moment is another tenet of ACT. So does anybody do this right now? Does anybody do any mindfulness or being present, being in the moment with their client? And if so, what does that look like? How do you engage your client in being present? I know you're doing it because I see it in your notes.
I do like the grounding techniques, especially when they're feeling like very overstimulated or super like spaced out, kind of bring them back to themselves in reality.
Okay. Okay. So like maybe like physically like grounding, like feeling the ground beneath your feet or feeling, feeling your hands on the desk, that type of grounding, or what does it look like when you engage it?
I specifically use the coping skill 5 4 3 2 1.
Okay.
I don't know if you've heard or seen that one, but I figure for some reason that one has always worked best for me because I feel like it's an actual thing for them to feel
Mhm.
and do,
Mhm.
to be in the present. But I haven't used any other grounding techniques that have worked for me yet, only the
Okay.
5 4 3 2 1 one.
Okay. Okay, great. Thank you. And then there's something in the chat also. Let's see. Christy is talking about listening to hard rock music because they can relate to it. Okay, interesting. Madeline says doing journal prompts about past, present, and future to practice differentiating between the three. Yeah, that's a great thing to do because really, dwelling on what's happened in the past is over. Talking about what you can and cannot control, the past is completely out of your control. It's done really and over with. Likewise, spending a lot of time and energy worrying about the future often also is not helpful either, because that event that they're worried about may or may not actually happen. But what we do have control over, kind of going back to control, is what's going on right now. What are you thinking right now? What's going on in this moment? So that's a very interesting way to kind of link back acceptance to cognitive diffusion to being present and sort of link it back to control. Great. This next one is kind of a little bit of an abstract concept, but once I explain it and give you an example, I think it will make sense. This is the fourth one, is about self as context. And again, you're noticing your thoughts, but you're kind of taking it a step further. In this particular step, clients are working to kind of observe themselves as separate from their thoughts, separate from their feelings, separate from their experiences at any given moment, and try to get rid of that attachment. So the best example I can think of to illustrate self as context is kind of finding value in yourself because you're a human being, not finding value in yourself because of what your job title is, or because of how much money is in your bank account, or because of your situation. Yourself as context is I am valuable because I'm a human being on this planet. I'm here right now and I have value. So that's kind of the best example I can think of for self as context. And this may really apply to those of you who may be working with clients, maybe in a long-term care facility, because think of their sense of self and how it may be tied to the job that they used to have or the home that they used to live in, and the changes they're going through in their life. They may be struggling to kind of figure out who they are now that they don't have those job titles, those roles that they used to play or even live in the places where they used to live in the past. So this is another place really where TBS could really engage clients, again, on another pros and cons list of, what is the pros and cons of this new stage? And they may really need your help to find those pros. But I think when you come back to it and you revisit it and you give them time to think about it and you follow up on it, I think you will be able to help them find both pros and cons of themselves in their current, present situation. So that is self as context. I really like that idea. It's not an easy idea sometimes to convey or to explain, but I think once you, kind of work through it with your client, sort of separating their value from things is where that self as context really starts to emerge. Values may sound familiar. Like I said, in week 3, we learned several. different values activities that could help a client to identify what their values are. And that, like I said, comes right from ACT. Those values activities are helping the client have a deeper sense of what matters to them, to help them make active choices about where they want to go. What are their goals? What is their future? Make better choices about behaviors that help them to live their best life, excuse me, that is in line with what their values are. So the first step may be to provide that psychoeducation, like we learned about in week 3, as far as what values are, maybe give examples, help them do maybe a value sorting activity. They may also need a lot of support to separate what are their values from other people's values that are important to them in their life. Maybe they have become so, worried and concerned about what other people think or what other people feel is important that they have lost sight of what are their values and what is important to them. Church, society, friends, family, neighbors could become blurry sometimes over the years. So that's again where a TBS could come in and explain, give psychoeducation and help a client to really identify and narrow down what are their values, discover what is really important to them is that step right there. And I'm just curious, since it is week 9 and we did those values activities back on week 3, has anybody been able to engage a client in one or more of those values activities? And if so, how did that go? What was the outcome of that? Either unmute and share, or I'll keep an eye on the chat here. Anybody doing any values work since week 3? Okay, if not, don't forget about them. I know week 3 was a couple weeks ago, but still a lot of, I think, interesting and some things to work on with your client can come from doing those values inventories and working on identifying values with your client. All right, the last tenet, if you want to think about it that way, in ACT, acceptance and commitment therapy, is commitment. So here is where we work on strategies that allow the client to take action towards what those valued goals are, and at the same time, help them and support them through experiencing those uncomfortable feelings and thoughts. And it's summarized there in the graphic as commitment is taking action to pursue the important things in your life. So this is also kind of where you can provide support to your client. Thinking back to previous weeks, we learned about stages of change. You can support your client and remind them that change is hard, that even though they have this commitment to be different, or they have this commitment to work towards these goals, it's not going to be easy. It can be uncomfortable. No matter what kind of change we're talking about, it's never easy to make a change. And you can maybe provide education about the different stages of change, help them identify maybe where they are. Also, where you can intervene as a TBS here when it comes to commitment is helping your clients see when a change is needed. You can support them maybe through doing a decisional balance matrix that we learned about in series 1. What are the benefits of changing? What are the benefits of not changing? What are the benefits of staying the same? What are the negatives of staying the same? So you want it to come from them. You're not trying to convince them to make the change. You want the commitment and the realization to change to come from them. But where you can come in and support them really is in checking in, helping them make a plan to stick to that commitment to change, and to help them maintain the progress that they have made, whatever that looks like for your client. Is it supporting them to make phone calls, supporting them to make appointments, supporting them to get out of their room? However you can help your client. It's a big place where TBS can work with clients in this commitment phase. And I think I saw something in the chat. I don't want to forget about that. Somebody in the chat says, doing a habit plan. Great. Oh my gosh. Yes, Jessica, can you talk more about the habit plan and how that comes in? Was it either in regards to values, or was that in regards to commitment that you're doing a value or doing a habit plan? What does that look like? If you wouldn't mind.
It was kind of both. It was kind of both. It started out with the habit plan was trying to get somebody just on track with priorities and what are things that you prioritize in your life. What are steps you want to do to, keep making forward progress and stuff. And the habit plan was interesting, just to kind of get an idea of like, or get a start a routine, I should say, of like activities, or I'm gonna hold myself accountable to do X, Y, and Z. We're still working on it. We're
That's okay.
making slower progress, but it's
That's
still
okay.
it was kind of neat to explore.
Yeah, and that's okay. I mean, no change is really easy. If anybody's tried to do a new exercise routine or stick to a new diet or even have a new work routine, any kind of change is difficult to adjust to. So if it takes some time, that's normal. It'd be abnormal to change overnight. Like usually overnight changes aren't sustainable and they don't last very long. So that's okay. If you keep coming back to it, that's okay. If you keep reviewing the habit plan, that's okay if you change the habit plan. Maybe they try out that habit plan and see, oh, this is not going to work. That going to the gym 5 days a week, that was not realistic. Maybe we need to revise that. That's okay. Nothing wrong with that. All right, great. So that is, excuse me, just a real quick overview of the 6 processes. I call them the 6 tenets of ACT, acceptance and commitment therapy. They can really be worked on in any order. And you may want to start working where your client is ready. Maybe they're ready to be present. Maybe they're ready to do mindfulness. Great. Start there. And then maybe work towards acceptance. Or maybe they're ready to start talking about what's important to them and their values. Awesome. Go there. And then maybe you can get a commitment to work towards those values and live in more congruent ways with their values. They are ongoing, and you could even be doing more than one of these at the same time. You may do commitment and being present together. They definitely overlap. And we're going to learn here in a minute about psychological flexibility. These ideas overlap, excuse me, and help your client to become psychologically flexible. And people who are psychologically flexible are able to cope better with changes in life, ebbs and flows, while still handling problems in unexpected and creative ways. They're not kind of stuck, like we were talking about earlier, on what they can and cannot control. They're able to kind of go more with the flow, handle problems, and think of creative solutions. When somebody is stuck, you may see them kind of like Henny was describing, repeating destructive behaviors or being in a destructive relationship, maybe. ACT, acceptance and commitment therapy, can be an extremely effective intervention wherever you start. So don't feel like you have to start at acceptance. Sometimes that's the hardest place. That might be the last place that you go is acceptance. You may start with one of these other ones first, and then acceptance could perhaps be last. I think I saw something in the chat. Oh, okay, Seneca. Awesome. Okay, cool. So that's just a real brief introduction overview, like I said, of those 6 processes. Keep in mind that they do overlap. You can do more than one at the same time. You can start anywhere and go backwards and forwards. It's not like a prescription where you have to do one first and then the second one next. You kind of want to know where your client is and just start kind of where they're ready. So just to kind of summarize, to kind of break it down before we go on to the actual activities that are based on ACT, really what ACT boils down to is A, for helping clients accept difficult thoughts and feelings. I would also say accepting being in a difficult situation. C is for connecting to what's important in their life, kind of going back to those values that we've talked about. But then taking it a step further, not just having those values, not just knowing what's important, but then taking action towards like living out your values and living a life that is in line with your values. So that kind of really is what it boils down to, is accept, connect, and then take action. So here in a second, we're going to start looking at some specific TBS, ACT interventions. But just to summarize, ACT encompasses psychological interventions or mental health interventions that use acceptance and mindfulness strategies, along with having a commitment to making changes, to having different behaviors. So you'll see those aspects in all of these interventions that we go through. So the first handout is this anxiety cycle. And this really outlines what happens when somebody is stuck in anxiety, or when somebody is kind of pulled into this loop of nonstop anxiety. And let me kind of zoom in so you can see this a little better. So we kind of start at the top here, excuse me, that they're experiencing anxiety because they're having those anxious feelings. Often they will avoid that situation, or they will avoid things that trigger those anxious symptoms. Here's some good examples: skipping class so you don't have to give a presentation, using drugs or alcohol to numb those feelings of anxiety, or putting off and procrastinating challenging tasks. Those are all great examples of avoidance. I also think of people who maybe let their mail pile up and don't open it, don't read their text messages, don't read their email. That's another way of like avoiding any kind of potential upsetting or triggering situation. So it could look different from person to person. Because it works in the short term. If I don't open my email, and if I don't open those bills for at least a minute, I'm not going to experience that anxiety that can come from doing those things. So I do avoid because it gives short-term relief. But in the long run, you know, over the weeks, over the months, over the years, if we keep avoiding, if we keep pushing things off, those anxiety-provoking situations are only going to get worse. You know, when I don't pay my bills, my car gets repossessed. Or, you know, when I don't, pay my rent, I get evicted. So I may feel good avoiding my bills in the moment, but over the weeks and months, it's only going to make the situation worse, and it's only going to give me even more anxiety. Now, not only am I anxious about opening my bills, now I got to find a new place to live. I got to find, new transportation, how to get my car back. So exactly what it says there, the fear that initially led to avoidance worsens, and the brain kind of learns that when the anxiety producing situation is avoided, symptoms go away. So this is a coping strategy, but I would say it is not the best coping strategy to really help resolve those feelings of anxiety and really resolve what the situation is that could be causing the anxious symptoms. So I just wanted to check in real quick here. Has anybody ever used this particular theory of this avoidance and how it sort of feeds into anxiety? And if so, how was that received by your clients? Did it produce any change in their behavior? Did they start to confront those things that they were initially avoiding? We got some things in the chat. Awesome. In the chat, Brittany's working on this with a client right now. Okay. Yeah, nice to know that you don't have to go in order. Seneca has used this anxiety cycle and it was received well. It's awesome. Can you talk a little bit more about that? How did you approach it with the client? How did you present it? And what was their response to this?
Yeah, so I have a client out at Woodside. Anxiety is super high. She's extremely restless, can't sit still. But I also found out that she never really understood anxiety, nor how it impacted her, which I'm finding with a lot of clients. Where a lot of people don't really understand their diagnoses.
Yeah.
So we were talking about anxiety little by little. And then one day she asked for a handout. So I kind of did my own homework and found this on that therapy or therapist aid website. And theirs is kind of the same. And then the next time that I seen her, we talked about it. At first she was like a little upset because she didn't think it like pertained to her, because how I see it is like sometimes we don't notice our own actions, we don't notice our own behaviors or something like that. But the more in depth that we went, she started to realize like, oh yeah, like these are the behaviors that I'm doing and stuff like that. Because especially with avoidance, social anxiety. I mean, like like you wouldn't believe. She'd rather stay in her room 24/7 than even go around anybody. So
Yes.
I think that's where like the avoidance piece of this kind of comes in.
Uh-huh.
She's still dealing with it. I think it's more or less of her learning how to cope with and understanding it. So
Absolutely. Right. So kind of really what this anxiety cycle, I think, is speaking to is, um, kind of really way back at the beginning where we were talking about, we're not trying to eliminate those difficult feelings. I can't really make your anxiety go away, but what we can do is see if the person is now ready to start experiencing those uncomfortable feelings in an attempt to kind of resolve them, confront them, and kind of maybe move past them. So that's where I think this anxiety cycle comes into ACT and how it could be useful, is having them realize that this is going on and that by avoiding, it may feel good in the moment, but in order to really resolve anxiety, we have to experience it and then figure out kind of better coping skills. So
can I say something about this?
absolutely, please.
I will say one thing that I found that did help was validating how my client was feeling. So when she started feeling like she wasn't, I don't want to say like not doing anything about it, but like starting to work through it is very difficult for her. Instead of like saying anything else, my clinical manager taught me to validate everything they're feeling, and it helps the process go easier because they feel like they're not alone and
Oh,
they
yeah.
feel like they're supported in a way, like no matter what happens, because we all have days where we have setbacks. It is what it is. We're all human, but when you validate your clients, like you're avoiding them, yes, but we can get through this, it makes them happier and it makes them feel more encouraged to keep going.
Absolutely. Yes. And I think that was really important what you said about helping people understand their diagnosis. You can kind of normalize it, that no wonder you're acting this way. No wonder you're feeling this way. You have anxiety. And what you've been doing is a coping skill, but let's learn maybe a better coping skill or one that will help you feel better in the long term and not just in the short term. So yeah, absolutely. That's a great point. Thank you, Seneca. Appreciate that. Okay, so that's one ACT based activity that you could certainly do with your client. Sounds like some of you are actually already doing it. Once your client maybe has done that and kind of understands the cycle, I would say do that first before going on to actually confronting avoidance. Because here's where we're actually asking people to identify strategies to be different or to act different or to have different behavior. So this is the confronting avoidance skill worksheet. It has some great examples, and it may help to first look at things that are just examples that other people are doing before we kind of look at ourselves and what I am doing. So lots of great psychoeducation here. Like it's normal to avoid, like Seneca was saying, to push away what feels intense or uncomfortable, but over time, it's not good for us. Here's just some commonly avoided experiences, thoughts that give us strong emotions or trigger anxiety, emotions that are intense, like guilt, anger, or grief. Definitely would want to avoid that, if we could, makes sense. And then sensations as well, physical discomfort, actual pain, makes sense that we would want to avoid that. How do people typically avoid those situations? Sometimes they distract themselves. I scroll on my phone. We all scroll on our phone when we're trying to avoid or distract ourselves from things. So that's very common, as well as these listed here. Somebody else mentioned being in denial. That's another avoidance strategy, just not even acknowledging it, not wanting to deal with it, very common. Projection is when you're taking your own feelings and then putting them onto somebody else. So maybe I'm feeling upset, I'm feeling irritated, but now I'm blaming my roommate. Why is my roommate so irritated? Why is my roommate so loud? Why is my roommate, so upset, when it's actually me who's irritated, annoyed, and upset? That's kind of externalizing it onto others instead of seeing yourself as having a problem. Another very common one, opting out. If you're unwilling to confront those tough emotions, you may just completely not go to those people that bring it up, not go to those places or situations that are likely to cause the uncomfortable feeling. So this is a great way to talk about it without maybe bringing it home to your client quite yet. Once they've maybe done that anxiety cycle, you've kind of talked about it in general terms, they might be then ready to go forward and talk about how maybe they're doing it. Once you have that rapport, once you have that relationship, you can help them name what they push away most. You know, is it a person? Is it a situation they're avoiding? Are they not opening their bills? You know, what is it that they are avoiding? And then start getting into what is the cost of that? You know, what happens when you don't talk to your daughter for 6 weeks? What happens when you don't leave your room for a couple of days? What happens when you maybe numb yourself with drugs or alcohol? What is the cost of that? Because there's the short term feeling better, but then there's the long term, you know, consequences that we want to be looking at as well. So this is really very helpful in seeing some general examples, but then once they're ready to kind of see it for themselves and talk about what they're doing, and then how could they benefit from confronting it? How could I benefit from leaving my room? How could I benefit from calling my daughter? How could I benefit from opening up my bills when I receive my mail? So kind of the cost benefit analysis is going on there. Again, you have to have a really good working relationship with your client to be able to do these, because next we're going to be asking them to then look at their beliefs about their willingness, you know, to be present, to do these things, to take those next steps. So are these beliefs 100% true? If not, what would be a more balanced view? So this may sound familiar from CBT, where we're challenging irrational thoughts or thoughts that aren't true. That's kind of a skill that would come in here. And then working with your client, again, this is not going to happen probably in one session. This is probably multiple sessions. So maybe a couple of weeks later, once they've identified their limiting
Game's
beliefs.
not going to start at right at 5 because they just got here.
Oh, I think.
Yeah.
Christy. People are muted. Sorry about that. Okay. So then the third step is helping your client to be open to difficult experiences. And almost where you come in as a TBS is coming up with a plan. So what is that going to look like? What are 2 ways that your client could welcome that experience the next time it arises? Maybe it's just simple as answering their phone when their daughter calls, or just opening up their mail as soon as they receive it. Maybe as simple as resisting a distraction, not scrolling on your phone, allowing yourself to feel an emotion. Like Seneca was saying, you know, it's okay to be irritated, upset, angry, choosing not to run away from the situation, staying present, or whatever applies to your client. So here's where you come in as a TBS, is what is the plan? How are they going to not get stuck in this cycle? So really this handout is this step here. So what are they going to do so that they are not avoiding, is kind of where that handout comes in. So you could use the handout, you could just use it to guide your conversation. I think I was talking to Henny, or I forget who it was after class last week. You don't necessarily have to use these exact handouts. These could guide your conversation, or they could inspire you to make your own activity. This is just kind of a good way to organize those questions and to organize the ACT steps into one handout. Oh, we got something in the chat. Oh, Christy, you're fine. You're okay. Okay, so that is the confronting avoidance and kind of coming up with a plan. Concrete ways to face what they've avoiding is what's outlined there. Okay, so then we're going to move on to another ACT related activity, which is talking back to your anxious or negative thoughts. You may hear your clients saying out loud their anxious or negative thoughts. Just real quick, what are some anxious or negative thoughts that you've heard your client voicing? What have they explained, or how have they described their anxious symptoms, or what are some negative thoughts that come up frequently? Either unmute or go ahead and put it in the chat just real quick before we go on to how to tackle those.
My clients say that their anxious thoughts are kind of like racing thoughts, kind of like a train that's going like super fast. You
Okay.
can't really stop it.
Okay. So they feel like they have control over it, sounds like. Yeah. Oh, something in the chat. Excuse me, I'm losing my voice here. My family keeps my money. Okay. Some other ones that I just kind of brainstormed myself. I'm so annoying. Nobody wants to hear what I have to say. Nobody cares about me. Just kind of those automatic sort of blanket negative thoughts that probably are not 100% true. Here's a couple more. I don't like crowds. I don't have control over anything. Staff want to control my life. My husband's going to divorce me. Okay. Yeah, you guys definitely get the idea. So when you hear your client talking about that runaway train, kind of like Seneca was describing, again, do some psychoeducation with your client, normalize it. Like Seneca said, that thoughts have a way of consuming our attention, especially when they are negative or when they are upsetting. It's natural to want to think about those. It's natural to feel stuck inside a thought and to feel like you can't focus on anything else. It can be described as being fused with your thoughts. Remember, we talked about self as context. That is what is helping us to remove ourselves from our thoughts. But when you're stuck in these anxious or negative thoughts, you feel like you are your thoughts. You feel like you are, anxiety. You feel like you are. Those thoughts are true. Really is what I'm trying to say here. So here's just one technique. It's called thought diffusion to kind of break free from that trap that we are not our thoughts. And I'll pull up the actual handout so you can see it better here in a second. But essentially, this activity, this approach, doesn't even have to be using this worksheet. It works by helping your client shift the attention from what they're thinking, the content of those thoughts, to kind of the process of thinking, to kind of take away the power that those thoughts may have. So let me pull up that actual handout so you might be able to read it a little bit better. And again, if you just want to describe these techniques to your client, maybe use one every session. That would be a great way to approach it. You can also just give them this handout. They could practice them on their own once they have learned them and really mastered them with you. But here's just a couple. So put your thoughts on a cloud. So some of these involve imagination, imagining your thoughts on a cloud, high in the sky, watching those thought clouds slowly drift away. And then reminding yourself that just like those clouds, thoughts really have no actual substance. They just kind of come and go. I also think of it as like blowing bubbles. Your thoughts are in the bubbles and they just kind of float away. A couple others, I just don't want to run out of time here, so I don't think I'll get to all of them, but please take a look at this handout and see if any of these might work with your client. I also like this clicking the X button. Again, if people are technologically inclined, this may be working for them to think about clicking the X button on that thought. That thoughts can crowd your mind like dozens of browser windows open on your computer. Like you see, I have all these tabs open. Maybe an activity is thinking about X out, X out, X out, X out, X out, all of those negative thoughts, and then just watching them disappear. It can be a very visual way to think about it. Let's just do one more. The last one here on the bottom is zoom out. When you're fused with a thought, when you feel stuck in it, picture yourself rising high above the earth. Notice how tiny your worries look from space, and think about, does your triggering thought feel as significant from this distance? So these are all very kind of visual things, but I think can help kind of break up when a person is really stuck and fused with their thoughts. And it's kind of described up top when they would use it. A person would use this when thoughts are spiking their anxiety, worsening their mood, when they lose perspective or become really fixated on one particular thought, or when they're preoccupied, when they're not present. Remember back to our octagon or hexagon, that being present is part of ACT. When they're not able to be present, might want to engage them in some thought diffusion to help them to become more present in the moment. So again, use the worksheet or just introduce the topic, whatever works best for your client. I'll get through one more here, and I do want to leave a couple minutes for thoughts and questions about the final. But the last one is about psychological flexibility. So that describes a person's ability to adapt to life and life's difficulties, but still remaining true to one's values. So first we have to know what our values are so that we can stay true to them. But this is a great handout for helping somebody to become psychologically flexible. Let's look at that real quick. So this is a great way to sort of summarize for them if they are going through all of the ACT steps, or if they're going through all of the ACT ideas, and sort of to remind them where they are. That's the first part of this particular handout. Let me zoom in and make sure we can see it better. Then going on to the next page are tips on how to become psychologically flexible. And there's one for each of those ideas, each of those tenets that we mentioned earlier today. So here's some tips for acceptance. If somebody's struggling with acceptance, I might give them this action step. Notice the next time you try to push away an unpleasant emotion. Instead, allow it to be there. Explore how it feels in your body. What is it like to not resist your experience? So that's kind of embracing, accepting what's going on currently. Let's do one more. If somebody's having struggles being present, being mindful, being in the moment, an action step might be when they're lost in thought, engage with their senses. Maybe think back to those DBT skills, improves, all those different acronyms that we learned about in the first workbook, to engage their senses, to connect with the present moment, kind of like Seneca said, actually exactly what Seneca said. Notice 2 things you can hear, 2 things you can see and smell in your immediate environment to kind of bring them back to the moment. And there's some great action steps for all of the other tenets of ACT that we learned about today. So this is a great overall handout to teach what ACT is, and then action steps to help people to become psychologically flexible and just better able to cope with what's going on in their life, the ups and the downs. Okay, let's just wrap this up here. So real quick, this week, you're going to be doing a mental health intervention. One of the ACT activities that we mentioned earlier, you would be selecting. Perhaps it is a evidence-based treatment modality. ACT is evidence-based, or maybe a handout provided by therapists. You could check one or both of those. And let's talk about what you think about this client response. So Betty engaged in session and reported her emotional state as bored and lonely. Betty stated, quote, "Every time I try to make friends here, I just make a fool of myself, so I'm better off in my room watching TV." Betty was provided with psychoeducation about the anxiety cycle and voiced that she relates to it. Betty was assisted in completing the confronting avoidance worksheet and named socializing as the anxiety-provoking event she was avoiding by isolating herself. So what do you guys think about that? What could be added? What would you do different to make this just a little bit better as far as a client response? Or maybe you like it. If you like it, tell me what you like about it. Oh, something in the chat. Okay, Brittany says, it's okay. I would say how she felt after working on it. Okay, that's a great point. Yep, she did engage in this. How did it help? Did it help her anxiety go up or down? Was there improvement? How did she feel afterwards? I would agree with that. Anyone else add anything to the client response? I think it's one of the better ones because we do have quotations. We do have some of her talking about bored and lonely. We have exactly what it was that she engaged in. So this is better. It could be a little bit more detailed. Did the activity help? If so, how? But I think this is one of the better client responses that we've had. And then for our homework, let me know what you think about this one throughout the week. Betty will think of 2 limiting beliefs contributing to her avoidance, and will be prepared to discuss this at the next session. What do you like about it? What would you change? What's your feedback on this plan? Oh, something in the chat. Okay, when is the next session? What would I like to see? Okay. Can you say a little bit more about that? What you would like to see as far as what for her homework? I think it was Brittany. more specific coping intervention skills to be implemented. Okay, so just more specifics. Okay, yeah, again, this is one of the better ones, because we have numbers, we have measurements, we have exactly what she's doing, but it could be more specific as far as what actual skills she's doing, and maybe when she should be doing them. Okay, so just real quick, any questions? Does anybody need help identifying what activity they would use with their client that falls under the umbrella of a mental health intervention, specifically ACT? Or are people good on the ACT activities for the week? Okay. All right, so just a couple reminders about the final. You should have received the Outlook invite for our final. You should also, if you have not already, you should be very soon receiving the form in which to put your progress notes. But just a refresher, you have 2 weeks to get ready. You'll be turning in 5 of your progress notes with clients that you provided services to during Series 1 or Series 2 that you have not submitted for grading before. We were looking for your best notes. So ensure to submit at least 5 different notes which document 5 different interventions. And if you have not received it, this is what the form looks like. So you will choose which intervention was focused on, for example, in note 1, and then you will then attach note number 1, and you'll just repeat that 5 times on the form. And that is what will be due no later than 24 hours before your final. So any final questions? Everybody's... All right, let me check the chat one more time. Nothing else. Oh, okay, Christy, if you have not gotten that, I'll look up and see who you'll be meeting with. It might not be that you're meeting with me. So I will have that person send you that form if you have not received it. But thank you for letting me know. I appreciate that.
Do we get like a list with all the interventions or not? From all the classes?
So yeah, they're all listed here. Yeah, so
Oh, okay.
ongoing assessment of needs, you'll just choose one.
Okay.
So maybe your first note was about skill building. So you would choose skill
Oh, okay,
building.
thank you.
Yep, and then note number 1 would be where we're looking for your skill building activities. Yep. Okay, well, I'll stay on for a few more minutes. If anybody has any one-on-one questions, that's fine. Otherwise, that's all I have for you this week. Hope you have a great week, and good luck doing your ACT activities with your clients.